have Dr. Pittrell, who also happens to be my friend. So welcome, Dr. Pittrell. How are you? How are you doing?
Thank you. I'm doing pretty good now that this weather's a little bit better today, but yep, I'm doing pretty good.
Exactly. It's nice to see you. So today I'd like to talk a little bit about your PhD journey, how you decided to get your PhD and sort of what made you finish your PhD. Because sometimes people, get into the PhD program and actually don't finish. So what has been your motivation to, first of all, start your PhD and finish all the way through?
So perfect. Okay, so I am, good morning, everybody. My name is Dr. Kizzy Pittrell. I am a licensed professional counselor in Maryland. I've been practicing since 2005, but prior to that, I was working. I've always worked in mental health in some capacity. So I attended Bowie State, go Bulldogs, for psychology. And so most of the children I worked with were in placement because of some issue. It could have been abuse, neglect. They were under the custody of Department of Juvenile Services or Department of Social Services. So that's how they came into custody. So in any case, I did that for about a year or so before I decided to go back to school, because I knew that I did not want to do that type of work forever. It was a lot because the children had very challenging behaviors, self-injurious behaviors. We had kids who were AWOL, who would just run. We had children, of course, with anything, abuse issues, trust issues, children who had different diagnoses. So it was very challenging work. So I knew I did not want to do that forever. And also, the pay is not great when you are just an undergraduate BS or BA with a psychology degree. So I worked at agencies for a little while, probably for like a year, and then I went into my graduate program. I got accepted into Towson University. And Towson, they had 3 programs. They had a rehabilitation psych program, a clinical psych program, and a community mental health program. I think that's what it was called back then. I think it's changed now. And so I knew I didn't want to be stuck testing, which is what the clinical psych program was, just a lot of testing and evaluations. I wanted to do a little bit of like therapy. And if I could do testing, that was fine too, but I knew I wanted to do therapy. And so the community mental health program appealed to me more than the others. And so I did that, completed my graduate program while still working full time. Actually, as soon as I completed my my master's degree, I was accepted a position at an outpatient mental health clinic in Baltimore City. At the time, this is a funny story about it all. At the time, Maryland did not require mental health professionals to be certified, at least for counselors. Social workers always had to be certified. Counselors did not. So I graduated in May. I had a full-time position as a therapist in June. So like 2 weeks later.
Oh, wow.
So I was excited because it's like I had my degree. I finally got a job because when I finished my undergrad degree, it took me like 6 months to get a job. So again, where do people go with undergraduate psychology degrees? There's not too many options for us. So I worked at this outpatient mental health clinic in Baltimore City. It's still around. And the clients I had there were clients who had long-term chronic mental health issues. So these were clients who really, if you think about it, they were clients who probably at some point were connected to like Department of Behavioral Health Services, like state administration, and hospitalized for long periods of times. And these were people who were integrated back into the community. So a lot of my clients some of them did work, but some of them lived in like, like community housing where they had people to kind of like support them. Yeah, like residential. So I did that. But what that actually allowed me to do was see mental health on another scale with adults, because of course I did the work with children, but I wasn't a therapist then. But this introduced me to like the textbook stuff that we always read about in school. And these are people who had chronic mental health issues. So, and the doctors I worked with were very knowledgeable, very smart. Actually, our medical doctor, he was a medical doctor. He had a position at Hopkins. He did a lot of research and stuff like that with patients. And a lot of these patients were his patients who had been his patients for years. So they were like severely. So I would tell my students now, like, I was introduced to like people who were really diagnosed with bipolar and really diagnosed with schizophrenia and really diagnosed with all these, these things we read about in school. I actually saw that in an outpatient setting. And so I did that for a little while. And then the state of Maryland said, you know what, you guys can't work anymore as master's level clinicians, you have to be certified. So I had to go re-enroll back into Towson and finish up. I took like a certificate of advanced study program to complete my 60 credit hours because I graduated with like 39. So I needed 21. And then once I completed that, then I was eligible to sit for the licensing exam, which it was so confusing back then. Because a lot of my colleagues graduated with just their masters. Many of them had moved out of state. So I don't know if they ever went back. I mean, they probably did at some point, but Maryland didn't require us to have it. You could have your master's and work as a master's level clinician. So, and so once I became certified with my LGPC, which is also it was a pretty new credential. And we're talking what, 2002, 2003. It was a fairly new credential. I left that agency and I moved on and I went back working with children again. I went to Catholic Charities and I worked in that capacity, doing work with treatment, foster care, and youth in the system. And then from there, my journey kind of continued. Left there, went and worked for an agency working with addictions, adults who had co-occurring disorders, many of them co-occurring disorders. And I did that for a few years. And then I landed back into an outpatient mental health clinic, this time with adolescent teenagers in a group home who also had co-occurring disorders. And then my journey just continued, did that for a little while as a therapist, then became promoted at that agency as a clinical supervisor. So now I'm supervising people who are, they were substance abuse counselors. So we did substance abuse assessments for the courts to determine if the youth needed to be in treatment for drug, alcohol use, or mental health, or both. And then after that, just kind of did a couple of contractual things, clinical supervision, and then finally came into private practice.
Yay!
So I say all of that to say, so in between all of that time, it was probably about 2009. So 2009, I was working for an agency that was providing substance abuse and mental health services to adults and youth. And I was with the agency for 7 years. So while I was there, I decided to go back to school to obtain my doctorate degree. So I said to myself, and I don't think I put too much thought into it.
I was going to ask you, like, what was the thought behind that?
I don't think I put too much, because the funny thing was I tried to go back to school for my doctorate degree in 2007. I was looking online. I knew I could not do the traditional brick and mortar type of classroom setting. So I knew I had to do something that was hybrid. So at the time, the only schools I remember looking into was Capella and Walden. But for some reason, Capella was pulling me to go there. I remember having like a introductory, like a interview, and you kind of went over. I started the process with Capella, but didn't finish, because also at that time, I think I stopped the process because at that time I felt like I just had too much on my plate. The agency I was working for was addictions. It was very demanding. My clients were relapsing. Some were just dropping out of treatment. So it was a lot. My daughter was probably elementary school at the time. So then getting her acclimated to all of that. So I was like, maybe this might not be a good time to go back to school. So that was in 2007. And I continued to work and do all of that, left that agency and went to another agency in 2010. So somewhere between me leaving that substance abuse agency and going into the other agencies, when I made the light bulb clicked and said, maybe I should go into, maybe I should get a doctorate degree. I honestly think though, I remember, let me go back. I do, again, I didn't put a lot of thought into it, but I do remember this. I was at a girlfriend's house for a gathering, and one of her girlfriends, well, her line sisters rather, she and I got to talking, and she was telling, her name is Monique. Monique was telling me that she was in school working on her doctorate degree, but she's in like a different field. She's a principal now at a school down in like in Southern Maryland, but
Okay.
that was her area. So
Yeah.
we were talking about graduate, doctorate programs, and she was actually enrolled in Argosy. And that's how I found out about Argosy. So
Okay.
she was enrolled in Argosy, and she was telling me about it. And I'm not gonna say she kind of, I think she just, the conversation kind of gave me the green light and said, just go ahead and pursue it. So after that
Yeah.
conversation I had with her, I remember like a few days later, went on their website, pulled up some information, did a little bit of research, not much,
Mhm.
applied, and then interviewed, was accepted, and got into the
There you
program.
go. Yeah.
I don't know what I was doing. Like, honestly, I'm like, I don't know. I know I want to. I think for me, because I was always doing the clinical work, I think for me, the only thing I thought about was maybe this will give me the credibility to teach and research. Those are the only two things that I'm missing at this
Yeah.
point, teaching and research.
Yeah.
So if anything, that's the only thought process I had.
Okay. And it
Yeah,
worked well for you.
it did. And you know why? Because I was already working as a clinician all those years.
Yeah.
So I already had all of that experience. However, I'm going to be honest. I thought it did, but when I took my first course there, which was a research course,
Yeah.
and I can't think of the professor, she was a really nice lady. We talked about the imposter syndrome,
Mm.
and everything she described was me. I'm like, wow, because
Oh,
in
wow.
my mind, I'm going in with all this confidence. I'm like, yes, I've been doing this for a while. This should be a piece of cake. The only thing that probably be a little challenging is the research and that piece, but I got a little bit of time to do that. But I know all this. I know this. But when I got there, you're with other people. Then I'm listening to everybody else's background. Like a lot of people were military. A lot of people had way more years of experience. A lot of people had life experience,
Mhm.
educational experience, military experience. So it made me feel like instead of that 12th grader that's graduated from high school, I felt like a freshman.
Yeah. That's so
So
interesting.
yeah, and a little bit, and then I think also the other piece was I thought I was a decent writer,
Mm.
but when you're writing clinical notes, it's different than you're writing a paper, a
On paper.
dissertation, a proposal.
Yeah.
So when I received my first in the same class, it wasn't a research class, but it was a class like to introduce you to the research process.
Yeah.
I remember that professor tore that paper up, and that made me feel from the ninth grader to probably the fifth grade. Like, what the hell?
Yeah. It's,
Like,
it's, a,
what is
it's,
going
a whole,
on?
it's a whole different type of writing, though.
Yeah,
You,
yeah.
you
But I
know.
didn't see it that way because
Yeah.
in my head, I'm like, I got this. Like, I have the clinical experience. I
Yeah.
have some life experience with, having experiences with my family, because actually the other thing that happened to me during that time, and this also could have impacted like what I was thinking and my writing.
Mhm.
My sister was actually diagnosed and hospitalized with bipolar disorder, and
Mhm.
that happened my first semester, first year. And so it was a lot of helping with that process and
Yeah.
helping the family with that. So that was on my plate as well. Now she's 100% better, but then, and it was a process for at least over a year
Mhm.
of her going through this whole, all of that, from hospital to not taking medication to taking medication to back to the hospital, like all of those things. So that actually happened my first year. So now looking back, that also could have impacted like kind of where I was, even though I went in with this whole arrogance, like I have this. But yeah, so
Yeah.
that was it. But I will say throughout the course
Mhm.
of my journey in the doctoral program, um, I've met some really dope people, awesome people that I still keep in contact with. We had to because, the school was small and there weren't a lot of African American students there.
Yeah.
And so the way I look at it, we had to support each other. I also don't feel so my successes, because that was one of the questions you had. Some of my successes were meeting some really awesome people, forming those relationships that has lasted and has now become professional relationships and beyond, supporting each other when it came to that, because I remember our professor saying, when you get to the dissertation process, it's a very isolated process because everybody's in a different area, and it's true.
Yeah.
But being able to still connect with my friends and my colleagues, even though they were all at different stages of their writing, some were ahead of me, some were behind me, some were with me, I still could connect. And because they family and friends were supportive. I will say that, even given all the stuff that I went through with my sister and her illness, my family and friends were supportive, but they don't get it like my colleagues.
So
I am the only
type of thing, right?
Yeah, I'm the only, and then many times when I went around them, because I had there were so many engagements and things that I missed because of being in school and having to study and having papers to write. And when I did when I went around my family for different things, I didn't want to talk about school unless they brought it up.
Yeah.
I'm the only child of my mother's. I have 3 siblings, 2 sisters and a brother. I'm the only one that has been to college this far.
Okay.
And I think out of my entire, like my maternal side of the family, I think on my dad's side, there are definitely some doctoral graduates. I think on my maternal side, close, not extended, like 3rd and 4th cousins, I don't really know them.
Mm-hmm.
I think I may be one of probably 2 or 3 people that have a doctoral degree. If that, I would have to double check, but I may be one of maybe 2 or 3. And my mother had a really pretty, like, 12, 13 siblings. So she came from a big family.
Okay.
So it's difficult to have those conversations with them.
Mm-hmm.
And I felt like I don't want to, keep talking to them about, what I'm going through and my challenges with school or my successes with school. And the only thing, honestly, on their mind, the only thing they wanted to know was when was the graduation.
Yeah.
And when can I call you doctor? I don't even think, as a matter of
when can I call you doctor? That was always a thing, right?
Husband, who was actually my fiance then,
Yeah.
he and my daughter, they knew that I was doing all this work behind the closed doors. I was, doing these interviews. I was in school on the weekends and all this. I think the first time they really heard my study was when I was practicing for the defense.
Mm-hmm.
And they came with me to see it. And that was the first time they actually saw the entire presentation. Like,
nice.
They're like, wow, you've been in school for all these years. This is it. So they didn't even, and these are the people in my household. So they didn't really know what I was doing all that time, going to the library at 11, 12 at night and staying there till 2, 3 in the morning. Like, they didn't even know what I was doing.
Those days. Oh God.
Yeah. So, but in terms of school though, the network, because it was such a small population of African-American students, I tried to connect with them. Mm-hmm. And that's how we support each other. That's what got me through, faith, my connection with my colleagues, and of course, family.
That's wonderful. That's wonderful. So, so what would you say for anyone who is wanting to go down the PhD path? What would be your advice for them at this point?
I would definitely say to research. Well, first of all, really think about if that's what you want to do, if that's something, because looking back, honestly, like I don't regret anything I did or that journey, because it definitely has made me a different person, more confident, more aware, more of a, I've actually been placed in these later years more of a mentor in a mentor role. So I don't regret any of it, not the ups or downs, in betweens, none of it. But I would say just make sure you do your research, because you may not need to have a doctoral degree to open a business. You may not need to have a doctoral degree to teach. I know people who are teaching at the collegiate level with master's degrees. So looking back now, I'm like, Kizzy, did I really have to go down this path? I could have saved me some money, because everything I wanted to do, I'm doing with, I used my doctoral degree in some settings, like when I was teaching at the college adjunct. So I do what I'm presenting and things like that. I use it for the business. So like my students and my employees will, Dr. Pittrell, but other than that, I'm not like doing any intense research or anything like that. But so I would say definitely research and make sure to determine your path. Are you okay with just a license? Do you need the degree? And if you do need the doctorate degree, what are you going to use it for? So I think that is most important. So research, that definitely research schools and programs to find out what's cost effective. And if it fits your lifestyle. For me, I needed hybrid. I had a young family at home. And some people may want face-to-face, may need to be in a classroom setting. So I think that's definitely important. And also, if a student decides to go down this whole path of like the counseling program, the doctoral in counseling, to determine if it's accredited, making sure your program is accredited. Because I know, for a lot of jobs, they want to see people, even though you have your degree, is it from an accredited university or not? So that's a huge factor. So just research, just do your research.
That's great advice. Thank you. And of course, the last question that I was asking is, what quote has inspired you and why has it inspired you?
Okay. Actually, I have it pulled up because I actually use this quote on my dissertation when I did my acknowledgement page of who I want to thank. This was a quote, and it's a quote from Booker T. Washington, and it says, and you probably are familiar with it, success is to be measured not so much by the position that one has reached in life as by the obstacles which he has overcome. And that speaks to all of us doctoral students, but I think I selected this as I was going through my process because this quote directly resonated with me. Going through everything with my sister and her illness, going through my own imposter syndrome, going through family stuff. During that time also, my husband lost his mom and a nephew. So I graduated in 2015. His nephew passed in 2013, mom passed in 2014. So that was right at the height. Actually, that was right at the height of I completed my coursework. I was now working on a proposal and all of that. So we had death in our family twice, so it was a lot. There was a lot. There were a lot of, and then of course, the support, all of my colleagues are in different parts of their process. I know I have my family to support me, but they're not familiar with this process if they haven't been down this road. So it's only so much I can really put on them. So again, it's not about, for me, it's about the journey more so the accolades. Because the journey is my testimony. The accolades are just the rewards of that of that. So that's the quote that I love, and I need to get it framed somewhere because I love that quote. Yeah.
Well, thank you so much, Dr. Pittrell. Thank you so much for your time. I know you are a very, very, very busy woman. You have a couple of businesses going right now.
Yeah.
And you work in Southern Maryland, right?
No, so I'm actually in Baltimore County, Rosedale. So I'm in private practice. So right now I am hiring. I'm hiring therapists and I'm accepting new clients.
Hey guys.
So I have I have one therapist already on board and she's seeing clients. So we're accepting children, adolescents, adults, for therapy. Right now we're providing telehealth services, and I guess once things are back to normal, we'll be back in the office. So that's one thing. And then I also, in 2019, my husband and I decided to go on this other journey of looking at a behavioral health program. So I also have a psychiatric rehabilitation program as well. So it's called Strengthening Families, Building Communities. So it's a PRP. So we are accepting adults and children for that.
In Baltimore, right?
Yep. So we service Baltimore County, city residents. The only criteria for that is that clients have to have Medicaid. But in terms of therapy, we see clients who have Medicaid, Blue Cross, Cigna, Aetna, private pay. So yeah. So those are the two businesses, therapy and the PRP.
Nice. And that sounds good. All right, Dr. Pittrell, this has been wonderful. Thank you so much for your time again. And
Thank
it's
you.
always lovely to see you.
Absolutely.
So
Thank you so
take,
much.
take care of yourself,
You
okay?
as well.
Okay.
Bye-bye.
Bye.